Hello class, and welcome to my presentation. My name is Brian. I am a registered nurse, and today I will be giving a presentation on mental health issues that are commonly faced by adolescents. This is an important issue because mental health issues are becoming increasingly prevalent among teenagers and young adults, especially in recent times. As healthcare advocates, it is our duty to both identify and help either treat or connect patients to the appropriate mental health resources that they require. So some of the key points that I'll be covering in this presentation will include an overview of risk factors for mental illness in adolescents, any contributing factors, the prevalence of health risks in our community, our role as healthcare advocates or practitioners, ways to identify the problem and address the issue. I'll also throw in a fun little activity towards the end. And lastly, we'll wrap it up with any help or support resources you can use in the community, basically to help with this issue. So it's no secret, adolescence is a period of pretty dramatic change. It spans from the ages of 10 to 19, according to the World Health Organization, although the specific age range may vary slightly depending on cultural and contextual factors. During this period, adolescents undergo significant physical, cognitive, and emotional changes as they transition from childhood to adulthood. In the physical development, we'll see significant physical changes, including rapid growth spurts, the development of secondary sexual characteristics, and changes in body composition. We'll also see changes in their brain structure due to the hormonal changes they are undergoing, which can affect their behavior, emotions, and their cognitive abilities. On the cognitive side, we'll see that adolescents are able to think more abstractly and reflectively than children, and they may engage in more complex sort of reasoning, planning, and decision-making. However, they may also be more prone to risk-taking behaviors due to their still developing capacity for judgment and impulse control. The prefrontal cortex is not fully developed at this point. On the emotional side of things, we'll see that adolescents experience changes in their relationships with others as they take on new and more challenging roles. We'll see that this can lead to adolescents experiencing greater peer pressures and the development of more complex, romantic, and potentially sexual relationships. They may also experience mood swings and heightened emotions, as well as increased self-awareness and self-consciousness. Overall, the developmental stage of adolescence is characterized by significant changes and challenges as individuals navigate their way towards adulthood, which includes increasing responsibilities and expectations that come with it. Here we can see a chart of Erik Erikson's stages of human development. According to his stages, adolescents are transitioning between two different stages of development during the period between ages 10 and 19. The initial stage, identity versus role confusion, is a stage where individuals are exploring their personal identity and figuring out who they are in relation to the world around them. This stage involves questioning one's values, goals, and taking on new roles and identities. Once an individual has successfully navigated this stage, they will move on to the next stage in Erikson's theory, which is intimacy versus isolation. This stage occurs during early adulthood, typically between the ages of 18 and 35. In the intimacy versus isolation stage, individuals are seeking to establish close and meaningful relationships with others. This stage involves deepening strong emotional connections with others and establishing a sense of trust and intimacy with romantic partners, friends, and family members. If an individual is unable to establish these relationships and experiences feelings of isolation and loneliness, they may struggle with feelings of despair and a lack of purpose in life. On the other hand, if they are able to form close relationships with others, they will typically experience a sense of fulfillment and purpose, which can lead to greater happiness and well-being. So there are multiple risk factors that can increase the likelihood of mental issues in adolescents. Those factors include genetics, family history of mental illness or mood disorders can increase the likelihood. There's strong evidence that correlates increased likelihood for an adolescent to develop a mental illness if one or both of their parents have the mental illness. If one parent has it, it's a 6 to 10% chance that the child will also develop it. And if both parents have it, then there's a 40 to 45% chance that the child will develop it. Another risk factor is trauma or abuse. Experiencing any form of physical, emotional, or sexual abuse can increase the risk of developing mental health issues in adolescence. This can overwhelm an individual's ability to cope with stress and contribute to long-term emotional, mood, and behavioral disorders. Another one is substance abuse, of course. Adolescents are commonly being peer pressured by their peers to engage in, parties and all sorts of new activities that involve drugs in many cases. But this can also worsen mental health issues and even trigger a whole episode for somebody. So adolescents need to be especially careful when being confronted with the peer pressure to do drugs or any sort of substance. Another factor is social and environmental factors. Adolescents who experience poverty, social isolation, discrimination, or bullying can be at a higher risk of developing mental health issues. These individuals don't have the same access to mental health resources, support, or treatment as adolescents from more affluent regions, and therefore do not have the same ability to manage any mental illness they might develop. Another one is chronic medical conditions. These, of course, just create a large amount of stress in general for anybody who might have one. Some conditions like diabetes or asthma can cause this sort of stress, and it increases the risk of developing mental health issues. These conditions can create chronic debilitating pain in the adolescent or disturb their body image even, which in turn can worsen the way they look at themselves, how others perceive them, which can lower self-esteem and cause all manner of mental issues. The last one is hormonal changes. Of course, adolescents are undergoing puberty during this time, which entails large amounts of hormones entering their system, and which in and of itself can influence our behavior, our mood, the way we feel, even body image, all sorts of things. So now let's go over some of the common mental illnesses that we'll see in our patients. It's important to note, however, that some of these conditions are complex and can affect each individual differently. There's many different types of mental illnesses, and each one has its unique set of symptoms and causes. Here's a brief overview. The first one is anxiety disorders. They're characterized by excessive worry, fear, or nervousness. Some common anxiety disorders include generalized anxiety disorder, panic disorders, social anxiety disorders, and specific phobias. The next category is mood disorders, and they're characterized by extreme changes in mood or emotion. The two most common mood disorders are depression and bipolar disorder. After that, we have the psychotic disorders. In these, we'll see that our patients have a break from reality. They may start to see things that aren't there or hear things that aren't there. They may have thoughts that aren't congruent with reality, or just have disordered sort of thinking patterns that aren't functional in the real world. The most well-known psychotic disorder is schizophrenia. Next, we have personality disorders. They're characterized by deeply ingrained patterns of behavior and thought that are problematic and cause significant distress or impairment. Examples of personality disorders include borderline personality disorder, narcissistic personality disorder, and antisocial personality disorder. Next, we have the eating disorders. They're characterized by unhealthy eating habits that may include restrictive eating, binge eating, or purging behaviors. Example of eating disorders include anorexia nervosa, bulimia nervosa, and binge eating disorder. Next, we have substance abuse disorders. These ones are characterized by a problematic pattern of drug use or alcohol use that leads to a significant impairment or distress. Substance abuse disorders can include alcohol use disorder, opioid use disorder, and stimulant use disorder. Lastly, we have the obsessive compulsive and related disorders. These ones are characterized by intrusive thoughts or compulsions that are difficult to control. Some examples of these include, of course, the obsessive compulsive disorder, hoarding disorder even, and body dysmorphic disorders. According to the World Health Organization, approximately 1 in 7 adolescents worldwide experience mental health illness, with depression and anxiety being the most common ones. In addition, half of all mental health conditions start by age 14, and 3/4 by age 24. In the US, the National Institute of Mental Health reports that about 1 in 5 youth aged 13 to 18, or 21.4%, experience a severe mental health disorder at some point during their lifetime. The most prevalent mental health conditions in this age group include the anxiety disorders, major depression, and attention deficit hyperactivity disorder, or ADHD. The prevalence rates of specific mental health conditions in adolescents vary based on various factors, such as gender, ethnicity, and socioeconomic status. For example, girls are more likely than boys to experience depression and anxiety disorders, while boys are more likely to have ADHD and conduct disorders. LGBTQ youth and those from low-income families or marginalized communities are also at higher risk for experiencing mental health conditions. In addition, it's worth noting that the pandemic has likely worsened the already grim status of mental health in the youth of our nation in ways that we are only beginning to understand. This is probably due to the increased social isolation that has been forced upon this population, who rely on their peers as a huge source of emotional support. This is also occurring at a time in their lives when they should be actively meeting new people and developing increasingly mature relationships with others. There is a potentially significant amount of mental health conditions that often go undiagnosed or untreated in adolescence, which can lead to a range of negative outcomes, including difficulties in school, problems in relationships with others, and an increased risk of suicide. To prevent the likelihood of these conditions worsening, early detection and intervention are crucial to promoting positive mental health outcomes in this age group. Here in this graph, we can see the top reasons why adolescents sought mental health services. Depression was by far the leading cause, with over half of the participants having reported it for being the reason why they sought mental health treatment. Thoughts of hurting or killing oneself, which is often correlated with feelings of depression, was the second leading cause, and anxious feelings coming close after. Other reasons mental health services were utilized included behavioral issues, uncontrolled anger, relationship problems, and eating disorders. So nurses are expected to play a pretty crucial role in preventing and treating mental illness in adolescents. Some ways in which the nurse can contribute to mental health prevention and treatment include, first is screening. Nurses can identify early signs and symptoms of mental health issues through regular screenings in their patients. They can perform depression, anxiety, and substance abuse screenings to detect any issues early on by utilizing an appropriate assessment tool, such as the Columbia Suicide Severity Rating Scale, or CSSRS. The next role we play is education. Nurses can educate adolescents and their families on the importance of mental health, coping mechanisms, and healthy lifestyle habits such as eating a healthy diet, exercising, and getting adequate amounts of sleep. They can also provide information on community resources and support groups that might be available for the adolescent to use. Next, we have assessment. Nurses can perform thorough assessments on their patients to identify the root causes of mental health issues. They should be knowledgeable about mental illnesses and how to screen their patients for them. Nurses can and should collaborate with other healthcare professionals to help develop an appropriate care plan for their needs. Next, we have therapy. No, nurses aren't therapists, but we can help to engage the adolescent in some therapeutic activities, such as counseling and other therapeutic services. They can use methods such as cognitive behavioral therapy, motivational interviewing, and other evidence-based practices, which can help adolescents manage their symptoms and even find a reason to initiate a change that they might need to achieve in their life. Next, we have medication management. Of course, the nurse is responsible mostly for administering many of the medications that patients receive. This includes psychiatric medications in many cases, and the nurse should be well educated about each type of medication that they might be administering and any effects it has, any potential adverse reactions to look for, and in some cases what the therapeutic blood concentration should be in their lab results. They should be prepared to notify the doctor of any adverse changes because of medication. Next, we have advocacy. Nurses, of course, should always advocate for their patients, and they can function as an advocate for the needs of adolescents with mental health issues. Nurses should work with policymakers to improve access to mental health services and reduce stigma as well. Nurses play an essential role in preventing and treating mental illness in adolescents. They should work collaboratively with other healthcare professionals to provide comprehensive care to adolescents and their families. So here are some of the commonly used screening tools that you'll see in practice to assess patients for common mental health illnesses. First off, we have screening tools for depression and suicide risk in adolescents. These include the PHQ, or Patient Health Questionnaire. There's a version that's specifically adopted for adolescent use. Next is the CES-DC, or Center for Epidemiological Studies Depression Scale for Children. We have the BDI-2, or the Beck Depression Inventory, the commonly known Columbia Suicide Severity Rating Scale, or CSSRS, the Suicide Behaviors Questionnaire Revised, or SBQ-R, the Beck Hopelessness Scale, or BHS. So those are the ones you're typically going to see used in practice for screening adolescents for suicide or depression risk. Next, we have screening tools that are specifically used for anxiety in adolescents, which include the screen for child anxiety-related emotional disorders, or SCARED, the Revised Children's Anxiety and Depression Scale, or RCADS, the Beck and Anxiety Inventory, or BAI. Lastly, we have screening tools for other mental health illnesses that we'll see in children, which might include like psychotic symptoms or mood disorders. This can include the Child and Adolescent Symptom Inventory, or CASI, the Strengths and Difficulties Questionnaire, or SDQ, the Prodromal Questionnaire, or PQ, the Brief Psychiatric Rating Scale for Children, or BPRS-C, and the Scale of Prodromal Symptoms, or SOPS. These scales are, again, primarily used to assess for the presence of any psychotic or delusional patterns of thought seen in adolescents. Okay, so skill check time. So the brain is a very complex organ that scientists are only really beginning to understand. But as far as mental illness goes, there are two main structures that are implicated as being involved with many of the mental illnesses that we see. So on this list here, choose the two most commonly implicated structures that scientists are researching that are involved with mental illness. Your choices include the hippocampus, the cerebellum, the parietal lobe, the temporal lobe, the amygdala, or the frontal cortex. So out of those 6 choices, only 2 are really implicated by scientists as being involved in mental illness. So go ahead and put your best guesses in. Let's see how smart you really are. If you answered prefrontal cortex or amygdala, good job. These two brain structures are commonly implicated by scientists as being involved in mental illness because, well, for one, the frontal cortex is involved in judgment and decision making, and especially in adolescence, it's not yet fully developed, so we'll see a lot of issues with decision making or responsible decision making in adolescence, which is why we see a lot of risk-taking behaviors. Also, the amygdala, more of a sort of central brain structure, has been known to be involved with a lot of emotional processing, and because of that, it seems to be involved in a lot of mood and other emotional disorders. If you or someone you know might be experiencing any sort of mental health issue out there, particularly children these days, there are plenty of help and resources out there for you to utilize if need be. Perhaps the most well-known is the suicide hotline, or 988. This is, the first thing you see when you search suicide on Google. It's just basically a lifeline for anybody who might be experiencing a sort of crisis or wanting to do suicide or, just severe depression. It connects you with a professional who's there to talk to you through your crisis and connect you with any appropriate resources you might need, or in some cases, even law enforcement. Next, we have the National Alliance on Mental Illness. This one offers resources and support for individuals living with mental illness, including adolescents. They offer education, advocacy, and support groups. We have the crisis text line, which I think adolescents will probably prefer, as many adolescents don't appear to want to talk on the phone as much these days. It's a free 24/7 text-based support service for individuals experiencing any sort of mental health crisis. Next is the Trevor Project. It's a project that provides crisis intervention and suicide prevention, but specifically targeted at LGBTQ youth. They have a hotline, text, and chat services. Next, we have Therapy for Black Girls. It's an online directory of therapists who specialize in working with Black women and girls. It's just another example of services attempting to provide a more individualized and non-biased approach to mental health care to underserved populations. Headspace is an app that you can download. It helps you to meditate and guides you through mindfulness exercises. They have content specifically designed for children and teenagers to help manage stress and other symptoms of mental illness. We got the Child Mind Institute. It's an institute offering resources and support for children and adolescents struggling with mental illness. They offer educational resources, support groups, and access to mental health professionals. Lastly, probably the most commonly used one in the US for mental health treatment is the Substance Abuse and Mental Health Services Administration, or SAMHSA, I think is how you say it. It offers a national helpline for individuals and families struggling with mental health or other substance abuse disorders. You can call them at 1-800-662-HELP or 4357. They offer 24/7 assistance. Thank you for coming to my presentation and taking time out of your day to learn more about mental health issues that are faced in adolescents. I hope that everyone was able to learn something new today and possibly is able to use what they learned in their daily lives. Mental health issues are no joke. Our country is facing a serious crisis when it comes to this, especially among our youth. This is likely due to how bad COVID has impacted everybody, the social isolation it's caused, the lockdowns, children not being able to go out and play like they used to, not being able to, talk to their friends about emotional issues like they once were. Not having that support system in place can wreak a lot of havoc for youth whenever problems arise in their lives. It's everyone's duty, I believe, to lend a hand to one another when things get out of control, when things are looking pretty grim. You don't have to be a nurse to go help someone out, or to just be a nice person and help them through a rough time. We can all do our part, I believe, to help make everyone's day a little easier, to help each other out whenever we can. Anyways, my name's Brian. It's been a pleasure. I look forward to seeing progress on this topic as our nation goes through these next few challenging years. Thanks.